Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, Taylor Haines has returned to Hanger from her 10-week fellowship, the Breece Fellowship. She did a fabulous job this summer learning about O&P advocacy and policy, and we're so grateful that she was able to join us, our 7th fellow. I mention this because the ABC Opportunity Fund contributed significantly to our 2024 effort to bring Taylor to Washington and have her spend the summer with us. We are so grateful to Cathy, the Executive Director of ABC, who shepherded the application through the Opportunity Fund Board, and we're grateful to the board for approving the 2024 donation. Along with other supporters and contributors, we were able to host our 7th Breece Fellow, and hope with continued support in 2025 that we'll be able to continue hosting Breece Fellows on into the future. So let me turn to the substantive update, and that involves upper limb prosthetic care, in particular coding. About 2 years ago, the NAAOP, along with its alliance partners and the Upper Limb Society of the American Academy of Orthotics and Prosthetists, began working together to try to clarify some guidance that had been issued by the DME/MAC medical directors involving upper limb prosthetic coding. The feeling was that the coding guidance was leading to restrictions and access to upper limb prosthetics for Medicare beneficiaries. We brought our concerns to the DME/MACs and to CMS. They met with us, they discussed it with us, and ultimately, to their credit, they retired in March of 2023 the upper limb prosthetic guidance used for coding. And some of the existing guidance that was in effect at the time continues to be in effect. So there are some confusions and some clarifications that we hope will be ironed out in the future. But one of the things that we made clear was that the code set for upper limb prostheses was outdated and needed to be improved. We therefore began the process of figuring out what would need to be included in a revised code set to better reflect contemporary upper limb prosthetic practice. Working with the Upper Limb Society, we ultimately supported the application for 12 changes to the descriptors of O&P codes for upper limb. And to its credit, the HCPCS work group, the Healthcare Common Procedure Coding System work group, made its decision, its preliminary decision, I should say, a couple of weeks ago, and ultimately did not decide to change the descriptors as we had proposed, which would have added the words partial hand and finger to 12 upper limb prosthetic codes. Instead, they decided to create 7 new codes for partial hand prostheses. One of the things we plan on talking with them about is adding the word finger in each one of these codes, and also clarifying some other aspects of the proposed code set that may cause some confusion and some problem. In particular, a lack of distinction between liners and flexible sockets, in addition to some confusion around base codes, and finally some confusion around what price would be assigned to these new codes, trying to avoid the gap-filling process. There'll be a preliminary hearing on November 8th, where the O&P Alliance and NAAOP and the Upper Limb Society will all testify and support improvements in these upper limb codes that can be enduring and impact patient care going forward. We plan on submitting additional code applications in the future to continue making the upper limb prosthetic code set more aligned with contemporary prosthetic practice. So I'll end on that, other than to say, please go out and vote. Important election in November, and we look forward to an update after the national election results occur. Thanks so very much.